My name is Damien McCallion. I'm the Chief Technology and Transformation Officer and Deputy CEO here in the Health Service Executive. I'm here to talk to you in the context of the Public Service Transformation Week, been organised by our colleagues in the Department of Expenditure and Public Reform. This week we're going to highlight a number of key transformation programmes and innovations that we're undertaking in our health and social care services that will help all of you as patients and public who undoubtedly use our services. Sláinte Care is the bedrock on which our health services plan is set out for the future, and that contains many strategies and policies and programmes, major change programmes that we're implementing, from areas as diverse as pre-hospital emergency care and our ambulance services, through to our acute services around areas such as cancer and women's health, and through to older persons and social care services in areas like disability and community services. As part of that, some of the examples we'll highlight this week will be areas, for example, such as our focus on waiting lists and elective care. We've seen post-pandemic huge increases in the number of patients being referred for elective care, and we have a very substantial programme being implemented around daycare. This will involve the establishment of a network of surgical hubs around the country which will separate emergency care from daycare. These will function 6 days a week, 8 to 8, and one of those is already open, the Reeve Centre in Tallaght. Another, Mount Carmel in Dublin, is due to open in South Dublin before the end of this year, with other openings then scheduled through 2025 and 2026. What those will allow us to do is to achieve our Sláinte Care targets for day case work in the public system, which is a 12-week maximum wait time for those designated procedures. And that's a really positive outcome for patients. That's a very substantial programme requiring capital investment, staffing, and a new way of working. But equally, we have lots of innovations happening in our health services in areas like virtual care with virtual wards, which allows patients either not to go to hospital or to be discharged earlier for hospital, and using virtual technology to achieve that. There are also areas through our Spark programme and other innovation programmes which are every day improving the service for our patients and the public in how our health system is working, and we'll highlight some others of those this week. Lastly, we're also moving to a new regional structure, and the regions are now in place in the HSE, which was a key part of our Sláinte Care reform programme. Those regions are now functioning, and we're developing those regions out. And the purpose of those regions is to ensure the decision-making and the responsibility is closer to the ground in the services, while they still remain part of the HSE and avail of those strong advantages around areas like clinical standards and programmes that will ensure we still get consistency, although we've now devolved that responsibility for care and management of care down to those local regions. So a lot of very exciting things that we're going to talk to you about this week. We have lots of challenges in the health system. We're seeing rising demand right across that. We're not immune to that. But equally we will ensure that we progress those big strategic initiatives while also supporting our staff in innovation. Finally, I just want to say with this week to thank all of our staff who are working on those big programmes, but also day to day are making those small changes that make things better for their colleagues and staff in the services, and most importantly for the public and patients. We all use those services at some point in time in our families and loved ones, and that's our ambition, is to try and ensure those are as good as they can be and maximise the resources that we have within our health system to do so. So some really interesting things to talk to you about over that week, and we will have lots of information around those through HSE website and through gov.ie.